Hello, guys. Welcome to Mics One JoeySooch. We are here with Emily Hall, and she is diagnosed with Ehlers-Danlos Syndrome, which
Yep.
is so it is a disease where you have stretchy muscles and dry skin, dry patchy skin, right?
That's like the tip of the iceberg. It's a connective tissue disease. So, everyone has collagen in their body, and it's in your whole body, your muscle, joints, everything. It's the quote glue that keeps your muscles, bones, joints, everything all working together. And when
Yeah,
that is disordered, it means you have a connective tissue disease of some sort. And a lot of people with hypermobile joints or other symptoms have EDS. And so that's like I said, the tip of the iceberg. I mean, it's a collection of so many different other disorders, which is how they can differentiate it from other diseases. And then also there's some genetic testing and things for certain types of it. So
and then that's just one disease. She also had Lyme disease. That's actually not person based. She got bit by a bug, right?
yeah. Yeah, it wasn't a mystery. I was grabbing some berries by the mailbox of my neighbor's house, and it's like a suburban style neighborhood, so the houses are, there's yards, but they're next to each other, and wouldn't expect it. And even though there is, it's wooded a little bit, but not, on the street or whatever. But grabbed the berries, came inside, had some weird feelings, just that I should do a tick check because I grew up doing tick checks, traveling and camping so much. And so my husband picked off some ticks, and I had a big giant rash ring on my hip area.
Oh no.
And I was not very proactive with it, which is part of the problem, because not a lot of people are proactive about it. Same with healthcare professionals, from the lack of funding, knowledge, and support. But
Really? Isn't it common in your area? I feel.
no, not here in outside of Atlanta and Georgia. It's not, you know, I wouldn't say it's as common as some of the more northern states, but nowadays it is pretty common in all 50 states. So some areas more than others, but it's been found in all the states. So, but yeah, so I went to urgent care less than a week later because I started feeling I had the flu like I never had before. Felt so sick, and I just was having weird symptoms. And when I say weird symptoms, I mean like seizure-ish type symptoms, like shakes and tremors on a level that I never had before. In the sense of a fever. The only other time I was ever that sick is when I had strep throat and some other things at the same time, and that was
Wait, so did you know you had Lyme disease or?
well. So I went to the urgent care, and then they told me, you probably have Lyme disease, but you might not. But you have the symptoms because when you have a fever, if you get bit by like a tick or a bug and stuff, any kind of bug, like if you get a fever after that, any listener, like please don't ignore that, because it can be a vector-borne disease. It can be a transmittable disease. Ticks are the poster child, but and I happen to have one of those little buggers.
And
But
then I also know that the earlier you get diagnosed, the easier the symptoms could be, and
yeah,
better.
so I got bit, and I didn't take the antibiotics because I had a weird feeling about it. I was on very heavy antibiotics at the time. I was isolating. I hadn't seen anybody that was my first time seeing anybody was at that appointment in a little while, because I had C. diff and E. coli.
Oh my
The
God.
C. diff, wouldn't go away. E. coli was in the news from the lettuce. A lot of people got sick from that a few years ago, still continually on and off. You hear about the lettuce in the news getting people sick. Well, we were those people that got sick from it, and then I guess that made us susceptible to C. diff. I'm guessing. I say I'm guessing because the specialists, they don't, they're not certain, because we tested positive for 2 types of E. coli and the C. diff at the same time. So, I'm just lucky. Sometimes I realize to be alive, and that's when I went through some crazy moments of not sure what was going to happen. Because once the Lyme disease started to kick in, I say, because I didn't take those antibiotics, because for good reason. I mean, if you go to urgent care and they're just like, here, take this, you don't necessarily want to take something anybody gives you. You want to check with your primary care physician, your general practitioner, whoever's managing your care, because you want to make sure that it's not something that's going to interact with any of your other medications or anything like that.
Yeah, they don't know your backstory. They didn't know what's happening now.
Exactly. I mean, this is just kind of a rule of thumb for anybody. You don't want to just, if you go to a doctor randomly that doesn't know your personal health history, that you don't necessarily just want to necessarily take something. You want to talk to your doctor and make sure, reiterating that. But
you want to be safe, like being part of the rare community. You're on so many different kinds of medications and different tests that sometimes they can, like you mentioned, that they interact with each other, and you don't want to hurt your body in the long run. Like having too many antibiotic for like 4 weeks, let's say, that's a really long time to be on antibiotic.
Yeah, you're right. And they just gave me like I think it was just like a 1 or 2 week dose of antibiotics, but I just knew that being on the heavy antibiotics that I was on already, I was like, I'm already on antibiotics, really heavy stuff. Like it's probably already working with getting rid of that stuff anyways, and the pharmacist said, thank goodness you didn't take that. That could have killed you. He literally said that, because the antibiotics they gave me for the Lyme disease would have made it worse, possibly.
Really?
Yes, there's certain antibiotics that, in the pamphlets, they even say like, oh, if you get profuse diarrhea or anything, call your doctor, anything like that, bad side effects. And then that, because it can be a risk of contracting C. difficile. It's a small chance.
Yeah, I did want to say that, like, Ehlers-Danlos, were you diagnosed since birth, or is it kind of like you were diagnosed later, but maybe were you born with it and then diagnosed later, or did it just start coming later in your life?
Well, that's the unfortunate part about EDS, is a lot of people are not diagnosed. I mean, these rare diseases, they should be diagnosed when you're young, so that way you can properly prevent a lot of the deterioration and the degeneration that happens with it. Some people don't find out they have it until much later in life, just because maybe it didn't affect them. Because here's the thing, it's a spectrum disorder, because it affects people. Some people don't have it very severely, and some people do. And what I mean by that is it does seem to be one of those rare diseases that can have a little bit more of a unique side of that to it. But the dynamic is part of the disease. That's what makes it, it's within itself. It's kind of hard to explain sometimes, because it is a disease like that, because of how it affects the body, how what parts of the DNA and the structure of the body that it's affecting, but these things, I told you before, and off of the record, that I had problems since birth. I had a lot of delays and health issues, and I was always that sick kid. I was always a little bit, behind. I needed help in school and all sorts of stuff like that. I had to get some assistance, with, learning conditions and things like that. So, but looking at the physical side of it, I mean, it's hard, because again, our system, especially at the time when I was born, I just turned 31 this year, but that kind of it kind of makes it hard to get diagnosed sometimes. Some people are diagnosed pretty young and some aren't, and if there isn't some really I'd say big telltale signs, I mean like physical quote deformities, like my daughter that, I don't know if everyone heard her or not, but
I do.
yeah, I know she was kind of like being a little bit loud. But she's 4 and she's sweet. But at the hospital when she was born, the attending physician, came up to us and gave us this news saying, unfortunately, your daughter has some physical features that indicate there's a genetic condition, so we need to do some testing. And
so is she showing symptoms now, or you just know that she had it?
well, what the symptoms were that they saw is she has lymphedema, and lymphedema is swelling of certain limbs, body parts. Her foot was like super swollen, and so were her legs, and a lot of her other body parts were a little bit extra chubby looking, and not like just like chubby. I mean, they look swollen, like
And then you would just go away, or
no, that's the whole point, is that so they thought she had Turner syndrome because of her physical features, because there's some other physical features of what somebody would have as far as like low set ears and other physical traits of people, genetic disorders. That's how they know, sometimes, I don't like to get into too much into that stuff because sometimes that kind of crosses the line into like, I don't know, eugenics and other things like that, those kind of topics where it's like kind of how much is that is, because people look at her and like oh wow, she's I would never guess she has an issue. But certain people that are trained, they know, and that's been a rough journey for us. Like I mentioned in the other podcast, we've been in some hot water because of some people that have been involved with her care that did not take the time to understand her, the specificity of her situation, just a lot of ableism and, comparing patients and all sorts of other issues that kind of go along with ableism in a workplace.
We talked an hour before the actual podcast, and we were just talking about how the rare diseases, there's a lot of rare diseases out there, but even if you're diagnosed with the same thing, it's not the same at all. Like people have different genetic codes and different ways of interacting with things. So yes, having a disease helps a lot, but like it's also very hard to help a person because every person is so unique, and it's hard to like help each other out because what may work for you may not work for me.
Right, exactly. I mean, there's over 7,000 rare diseases. I mean, that's a good amount. My daughter, she has one. I mean, I have another. She might have one of the ones I have. I'm still not fully properly diagnosed as well, as far as what's, going on with some of my other issues, because I haven't had a full genetic workup yet. I mean, the accessibility for some of these things is a problem. So the price has come down for this stuff, but not
what
much
is stopping you from having a full genetic testing? The cost?
Yeah, definitely the cost. I mean, it's that the cost is definitely a big barrier. I mean, not a lot of people I know that have just like $5+ grand to throw into genetic testing on a random day.
Oh yeah, I never did a genetic test before, so I had no idea that it was so expensive. I thought it'd be like maybe to go get a blood draw and like, oh, this, check. Oh, I want a genetic test. I didn't realize it was so intense. I think so. I was talking to someone else, and she was talking about genetic testing. And I didn't realize how detailed and how intense it is. I think it takes like 6 months to get your final results. Like I thought it'd just be like, oh, you just get a blood draw, and you just like you can test for different things. There would just be another like thing you check to think, oh, I just want a genetic explanation. But I had no idea it's so expensive and so intense.
Yeah, exactly. It really is, because the problem is a doctor can order a specific test, and they can test for specific area of genes where they think they're disordered. A specific doctor might be a genetics doctor, or it might be a rheumatologist or something, and they might be ordering specific stuff. Like, for instance, for myself, right now they just ordered metabolic genetic testing labs. That's not testing my genome or exome right now. That's my whole point, is like, if you're not going to pay for your full panel of all your DNA to be checked, it's going to take a lot of time and a little bit of money, and maybe a lot of money, to just get the basics done. But if you want to do like the whole thing, like I'm saying, that is a more direct, I think, is a better approach. But again, it's at least $5,000 or so to do all of that. From what I understand, if somebody knows something different, please contact me, because that's part of the problem, is accessing this information is some of the barriers and hurdles. I mean, just for myself to figure out and find out that insurance won't cover genetic testing unless it's, like I said, these specific small tests that are being ordered that are looking at a certain group of areas of the body that are disordered, or certain genetics. And it's very like nuanced almost, or whatever you want to say about it.
One of like the big problems in the rare community is, I would say number one is insurance, and them not willing to work with you, or like just being fickle or being annoying or whatever, or not understanding. And then another thing is money. A lot of the testing costs a lot of money. Equipment costs a lot of money. Like a wheelchair can cost $50,000 easily, and most of the time insurance don't even cover that, even though it's someone's way of life to do things. And like in your case, if you were just able to get that test, there could be so many more avenues you can go to help you in your situation. Like, the audience doesn't know, but we talked like an hour before this podcast, and she was telling me all her problems, and like she does have a lot of problems, but like some of these problems could go away if she had access to money, or insurance will help her more. Getting more help, and if she got more help, she'd be less stressed, and then less stress would be, the symptoms wouldn't come up as often. She'd be happier and just healthier. And that's kind of the hard thing. Like rare disease starts a domino effect. Like everyone could say, "Oh, this one disease is not too bad," but then it like evolves and it affects other areas of life, and it's like a web, and it just goes deeper and deeper, and it gets really, really bad.
Yeah, that's exactly right. I mean, when you have multiple rare diseases at the same time, I mean, I don't usually go into much detail about them, but I have a bunch of other disorders that some people may or may not have with the genetic conditions I'm currently diagnosed with, and with the Lyme disease. I eventually, months later, after I got that antibiotics, then I didn't take them, and had that whole experience, I eventually got really, really, really sick, even worse. And that I was already done with the C. diff antibiotics and the E. coli stuff. So, I wasn't going to be mixing medications anymore. So, but I was still on edge of having a relapse, as some of the specialists said. So I had to be really careful. Yeah. So I had to be really careful and figure out how to navigate that with the gastroenterologist and the other specialists I had at the time, it was kind of a piecemeal, because my PCP was trying to manage it all like himself with this stuff. And he kept saying, well, you really got to get to the university hospital system, because this is just, it's hard. And I realize now it is hard when the doctors can't communicate with each other as much. It's harder to have like a formal plan of action of all these things. And I'm definitely very thankful I'm in a spot where I'm at now. And definitely I've done a lot of these care managing situations for clients that I've worked in, caregiving field and personal assistance of multiple types. And so I was always used to helping other people manage their care needs in various forms. So it came pretty naturally easy for me to do it for myself, especially working for a physical therapy company and helping manage so much there. But then once, all these health declines happen, and when so much happens also at once, and then you lose your ability to work in the sense where there's something constantly coming up that's keeping you on the toilet, or something else that gets in the way. I mean, for me, like migraines or other types of tremors and muscle spasms and weakness, where I physically, things will give out in my body where there's nothing left to give, and where it's used up. I mean, I like to think of it like when I used to do, I was on a swim team for a while, and I remember the exhaustion that I had. Like, there was just like, you get to a certain point when you're competing and your body's just like, it's done. It's got nothing left. You ran out of the adrenaline, you ran out of everything. And then that was the only thing I could ever do competitive, because swimming, I mean, a lot of people know for like the disease that I have with EDS, like swimming and other forms of therapy like that can be really good for the body, because it takes the weight off the joints. I mean, you probably know, I mean, water therapy is so great. So I was not a good competitive swimmer or anything. I tried my best, but my body would give out like that. But so now my threshold for stuff, it's like, that's what a lot of people with these diseases go through, these dysautonomias, the dysregulation of your atomic system, your automatic functions that your body should be doing, and stuff like what you said, before, some of the things that you have trouble with, and these automatic things that just don't want to really cooperate and work. And when you're having to like tell your body to do the things that it's supposed to automatically do, then it gets kind of like a fun, tricky situation though, right? Because you're like, I told you to do this, body. Now I have to tell you, but you're supposed to do this automatically. And when I'm saying that, like putting one foot in front of the other, sometimes literally, like you're like, you misstep and you fall over or whatever. And everyone's grandparents go through this. Everyone prepares for these declines, but when you have to go through them young, like us, like it's humbling, but it's hard at the same time. Like you're just like, oh,
Yeah, we're like elderly people in like 20-year-old bodies.
Exactly. So yeah, that's my whole point with joking around about it. I mean, it's just how it is.
Yeah, it's a difficult, especially with rare diseases, how unpredictable it is, because your body is never constant. It's changing, or it deteriorates and you can't go back. Like for me, like one day I was able to walk, literally miles, and then the next day, I couldn't even walk like the 10 feet just to go to my bathroom. And it's just hard to fathom. Like, it's easy to joke around like before it happens and such. Like, you couldn't imagine happening to you, and then it happened to you, and it's just like, oh my God, like what do I do now? Like, you can't do anything. It's not like okay, so like you can get a wheelchair, that helps, but like you have to go out and get it. Not like somebody to go to a pharmacy and get like a cart of milk. Like, and it's not just getting something, but it's more of like a whole mindset. Okay, now you're like in a mindset like, okay, now I might be in a wheelchair for, let's say, 6 months or a year. Maybe it's forever now, and that hurts you a lot. Like, but like when you're going through a lot, you don't even have time to think about it. You kind of go, okay, I have to go to the bathroom, so I need a wheelchair to go there. But now you get onto the problem, like, how do I get from the wheelchair to the seat? Like, you're constantly learning about your body and doing things, and it's just not constant. It makes it so frustrating because, like you mentioned, like one day you could do this, and then the next day you gotta like tell your feet to go one step over the other, and it's just like like we both have rare diseases, so we share that sentiment that it's frustrating and difficult, and you just want to like yell and scream, but like you can't do that because like yourself, you're like we're the problem to our everything, and like doctors can't help you, family can help you in terms of like like helping around the house and such, but like they can't help you physically yourself. Like if you can't grab something, you just can't grab it, and it's just very frustrating. Like I lost movement in my arms for a long time, and I still get frustrated like if there's something out of my reach because if I had a normal body, it'd be like so simple. But just
Yeah, I feel your sentiments completely, and especially because for me, I feel like I think you and I have that in common where our arms and our hands, it's a big hard thing for us, and a lot of people I don't know. I would say like various disabilities, right? Like, but a lot of them have more like a lot of times it's in the sense of like if their legs are not work, like they can use their reach for things and stuff, and like I can't move around a wheelchair by myself or my shoulders dislocate, like I can't, like the things that reaching, like I have to wait for someone to reach for things up in a cupboard for myself. Like I want to reach, I want to do these things and I can't, and it's like, and that's what I'm saying, like I'm saying the variances of the disability sometimes can be so frustrating because it's like it's so wonderful to be working together and like work with people that can help you do those things, but sometimes it's just like you just want to do it yourself so bad, and society is so kind, they're so kind to elderly people about it, but they are not kind to us about it. It is a given that you can't reach certain things when you're elderly. They're so nice to people about it because it's like a given. But then if you're young and going through this, there's that bias and that thing. And then it also makes you feel just like so defeated, where it's just like people of all all abilities, if they can reach or whatever, it's like I want that so bad, and then to see the decline so quickly, it's like I didn't have time to prepare for this, like because society told me that you're gonna have time to prepare for this, right?
yeah, like we're supposed to be having these symptoms when we're like 70 years old, not approaching 30.
Yeah,
Like,
exactly. And that's I think where the frustration lies within itself, is this societal pressure to perform. And then to me, sometimes feeling defeated because I want to do something so bad. It's really just because I want to perform, and I want to do things and keep up and everything. But that's the biggest thing for me, has been learning to let go for a lot of that stuff. And like you said,
but you're losing independence slowly.
yeah, you lose a little bit of independence. But I think that in society we've been really kind of, unfortunately, it's been kind of driven in this capitalistic sense that really just leaves people marginalized in all sorts of ways. And even people who aren't considered marginalized people, you know what I'm saying, like within itself, because there's like communities within communities, right? Like how do I put it, a lot of people won't consider their disabilities a disability. That's a big part of it. It's just again, society and how we treat things and treat people. It's again just this not being very kind, that it's a given. You don't look twice at somebody using a wheelchair if they're of a certain age. And it's that whole quote, of a certain age. Like, where does that all come in, and why does that ageism and all that stuff exist? Where does that, I don't know, right?
I think, I mean, like, I know, like, society is, like, crappy in a lot of ways, but I also try to understand why people think the way they do. And, yeah, it's not common for someone young to be in a wheelchair or to use a cane. Like, a cane is associated with old people because, they lose, they lost the ability, they lost their balance or need support to walk, and that makes sense. And it doesn't make sense for a 20-year-old to be deteriorating so fast. But I think like and later in like life, like, there's more diseases and more education around, and like more education around, so like people are more aware of like diseases that are deteriorating, and like I don't know if that ever happened to you, but like every time I go out or like I go to a party, someone always comes up to me and be like, "Oh, like my sister or my cousin or someone had this disease," and they're like aware of it. So I feel like it's more known now, that more society is like less shitty looking down at people if they know someone that had a rare disease or debilitating disease, and they kind of open their perspective more.
Yeah, I think social media has definitely opened these doors within the past 5 years alone. Like, I think that that's where a lot of that comes into play is the destigmatizations of these concepts, Um, it's not easy, especially when, I mean, I personally struggle really pretty hard just even having this conversation right now. It's not an easy day, as yeah, Joey, but listeners don't know. I'm going through a pretty rough time right here. Have some, I have some migraine headache type things on top of a lot of other movement disorders that I have, and they're just causing issues in me not to be able to do things that I kind of want to do, which is, again, why I'm not working things. That's like it's not that I don't want to do these things. I fit physically and mentally can't. It's a struggle just to be, you want to be professional, you want to be on time for things, and you're at the mercy of your body at these in these moments. And it's so nice and wonderful when somebody can understand and relate in a similar situation, or they know somebody, as you're saying, like they just know somebody, and it's easier for them to understand, as awkward as it is, because sometimes those conversations, it's like unwanted conversation. It can be awkward because you're like, can my connection be with you that has nothing to do with my condition? It's like sometimes people don't look past, you know, the
I did want to make 2 points. One is that like to my audience knowing, like leading up to this podcast, I was like, I always want my podcast to be as comfortable as possible for the person. So just leading up to the podcast, Emily was nervous about being on a podcast. Like, is it a professional? Is it relaxed? Like it was my mistake that she didn't know, because there's no other podcast, no other interview I have, so she didn't know about that. So she was worried about that, but also like gets in the way. Like she was nervous if she would be ready for it. Like she mentioned like she has headaches and such, and like she would good she was not good 2 days ago, but like was better today, and like it could change from morning to evening. Like we talked this morning, she's like, I'm ready to go, and then like at 10, and I was like, I can't do it because I need someone to help me set the camera, and no one was there. And then like 1 p.m. came around, and I was like, hey, are you ready? And you're like, I don't know, like I'm not feeling well right now, like you're getting a headache right now, and then you also have a family, so you have to take care of them. So like I tried, like I know how it feels to be that someone needs to accommodate me and such. And I was like, hey, I want to interview my Emily, and I gotta do what I gotta do. It's like if she wasn't feeling well, like I would hope she tells me, and I would just wait a while, like we're doing the podcast now, or just say, hey, let's do another day. Like I understand, like I don't want you to be uncomfortable during the podcast, because that would make the product not what you want it to be. And last thing I wanted to, let's say we do a podcast, you're not feeling well, and then you look at it and it's like, oh my God, like that's not me at all. Like I want you, and I want the real you. Like I want the real you. And then the other thing is that a lot of people don't want to accommodate people, because just if it's like one little accommodation, oh, too much, they get someone else. I mean, sure, I could have gotten another guest, and that's fine, but I wanted to talk to Emily about her story, and it's like, what do I gotta do to have her on the podcast? And one of the things was like, maybe she'd be feeling it, maybe she wasn't, but like, that's fine, I get it. So I just waited and accommodated her. Like the audience doesn't know probably, but there'll be a lot of cuts in this, and that's fine. Sometimes we need a break, or she has children around and she has to take care of them, and that's completely fine. The audience don't want to hear it, but like that's his life of it, and I have to roll with it. And like I think what's important, I wanted to get Emily on the podcast, so I just did whatever I did to fit her lifestyle and to make her as comfortable as I can in terms of like through the internet. It could be a little bit different if we were in person, but like I just wanted to have her on the podcast.
Yeah, and I think that it's definitely goes to show it's a good point to make that both Joey and I don't have full-time personal assistants like some people are lucky to have. I say lucky because they're in the position to do so. I mean, I worked as a personal assistant professionally for different families where for various reasons needed personal assistance with their family, their jobs, everything that they have going on. I mean, people have busy lives, and if they can afford to do so, then they can do so. And I say afford because that's a sad truth. I know I've talked about it before in recent times with that other podcast I did. It's a big whole factor of things could be if both Joey and I were in the position to have personal assistants that can assist us just like other people do. I mean, celebrities, other people, wealthy clients, they do this is normal everyday stuff. Many of these people are disabled or they're not. I mean, it doesn't, but it's definitely this whole exclusive side of things where you have to have money to afford that kind of personal assistance, and I like to use the term very broadly because everyone has their own care needs. They have their own dynamic families, own dynamic everyday lifestyles, personalities. And it's not easy to invite someone into your life and say, hey, I'd like you to come and help me out with this and help me out and be there for me in this way. But we need to normalize these things because in many societies in the world, and I see different societies that are like different cultures, it's very normal and it was very normalized to have all of these community commitments and be helpful and not necessarily charitable, but have that community support in those ways. So we kind of lose out on a lot of that these days. We don't know our neighbors and things like that. Yeah,
behind most, I would say most rare diseases, it's always a person or a team that has to help them. Because no disabled person can be on their own. It could just be purely physical, like like in my example, setting up the camera. Or it could be a lot of other things, like Emily could do. Maybe she can live on her own for a while, but like sometimes she could just kind of have those days where she could need an extra pair of hands to do something. And every rare disease person, or most of them, need one person or a team just to get through life because they can't do it alone.
Yeah, and I say people in general because this is a struggle in communities in general. Single parents have these struggles, grandparents taking care of their grandchildren. I mean, these are all situations where people are, they're in situations where they don't have as much support as they could or should have, where there's always a space for more, and I'm not saying that they're not doing their best. That's not what I'm saying at all. It's quite the opposite. They're obviously doing the best they can with what they have and the resources they're either given or have connections to. But there's just so much opportunity for more because society just likes to try to say, oh, you should be independent and doing all this yourself and just just this by yourself, and this hyper independent state that actually just leaves people in a pretty anxious state of being. I mean, pretty isolating. And the pandemic has proven a lot of that. as far as that goes. But you know, I could go off
Well,
on tangents.
like the big thing is the best person to realize is yourself, which is true. But like when you're disabled, or I mean, honestly, really any person, they need some kind of support. You can't be an expert on everything. Like, let's say you need help, fixing your cable. You may know that, you may not. Or like, I don't know, maybe you need someone to help you open a jar of pickles. Some small as that for like parenting. Like sometimes you got to go work and someone has to look at the kids. Like you just need help. Everyone needs help. It's just unique with the rare disease because we need help to do basic things because there it depends on the disability. It depends on the team you have because if the more helpful the team is, the more like active you'll be. I'm sure there's a lot of these rare disease people that we have met or that really never met that they can't do a lot of these things because they don't have good help and they don't know what's out there and they're just stuck with their situation because they're stuck with it and they don't have power over it. Like if I didn't have like my mom helped me with the camera, she didn't want to help me with the camera. I couldn't really do the podcast and started doing the whole podcast lifestyle because I had to help. If she don't want to help, I can't do anything. And it would get frustrating for me because I can't. There's a lot of things I want to do, but I need someone to help me with a lot of the things, execute my vision. And there's things that I want to do that I just can't do ever just because my family doesn't want to do it, they're not comfortable, or it's not their lifestyle. Like I want to go travel across country. And I know that's like a lot of effort and such, and it's something I would love to do. Well, for one, it costs a lot of money, but two, is just I need a lot of help and such. And like my family are older folks, and they just can't handle that anymore. And so, like, I need to make new friends of one that will like me, and then two that will like be able to handle me, in terms of like let me go to the bathroom and eat feeding me and stuff. And it's just kind of like it has to be a perfect match to find that one person that's willing to be with you. And like it is also a personality thing. Like someone could come and like be next to you and try to help you, but they could be total different personality and they'll see it the same way, or they don't let you be yourself. So they go, "Oh, I'm just gonna give you this green shirt because I said so." But maybe you want a purple shirt.
Yeah, it's such a tricky situation. And for me professionally, with some of my certifications and backgrounds, like it's a given. Like that's just like, what you have to deal with. At the end of the day, I mean, that's, money talks, right? I mean, we sometimes people will do jobs. I mean, I look at it from both ends of the spectrum. I've done the jobs. I need the jobs. I've done, it's kind of like you just have to find like a right fit, like you're saying. Like sometimes the personalities clash, but like that's where the opportunities kind of change based on money, and that's where the opportunities, like you said, it takes a lot of money and effort and time to travel and to find those connections with people who are on board with all of that. Sometimes it's easier said than done, but it can be done. Like this doesn't mean we don't give up hope, and that those opportunities are there. And I mean, I know we talked earlier about like elderly people that hold double standard, but there's this whole idea of like, yeah, you're retired, you don't have that much time left, get on the road and enjoy yourself and do whatever you can to travel and stuff. Well, that's no different than what you and I want to do. We don't, a lot of people, our conditions, we don't, our time is definitely, it's looking a little different than the average person our age. We don't know. I mean, technology and things are amazing now in a lot of ways, but our lifespan is kind of, it's definitely more up in the air than someone our average age. There's a lot of complexities to this stuff, and there's no quote cures for a lot of the diseases and conditions we have. So it's just matter of fact, right? I mean, we have to look at it matter of factly. Like, other people might not see it this way, but this is the kind of health odysseys that, obviously I can't speak for you directly, but I know that these are just similar sentiments that, like, people with conditions that we have, like, this is how it goes. Like, our life isn't how much different. You made the joke earlier about being an elderly person in a young person's body, like, but that's how it is. And for people to not think that we don't want, it's funny though, because we want those same kind of opportunities, seriously. Like,
yeah, I'm sure if you talk to like a lot of the pretty disabled people, I'm sure they're like dying to like I don't know if like expand their horizon, but dying to do things that they're not, like, if they had like all the means necessary, they're able to do it, but they just don't have it. And so like, like they want to, like, I'll say like to go and travel, like, I'm sure it's, for a lot of people it's possible to do it, if they have like the right band to do it, and then they have like the right person to do it, like, that messes with their personality well, and I also like can understand them and like how to take care of them and such. And but like it's kind of luck based, because you have to have so many good things going your way. Like, you have to have money, so that's like one luck thing. Some are born into money, or they have a family that can support them and stuff. And then other things like the caregiving and stuff. Do you have a person that can come and take care of you? Like, let's say you're traveling, do you need help 24/7? That's a huge thing too. And then another, it's like, okay, yeah, you can have a person take care of you, but like, you don't like the person, but like, like, you don't want to be stuck with a person you don't like for 24/7 for let's say 2 weeks or even a weekend. So it's like, you have to have so many.
Almost like that whole concept of, that society says, oh, beggars can't be choosers. And I think it's a load of crap, right? I mean, really, at the end of the day, right? I mean, beggars can't be choosers. I mean, no, like, you shouldn't have to I mean, of course, like, you take what you can get sometimes in life, and you should have some sort of gratitude sometimes for these simple goals and simple things and simple wins. It's kind of a hard thing to balance that half glass empty, half glass full kind of thing. It can be really difficult in this rare disease space. It can, and chronic conditions, like, it can be really difficult because it's very time consuming within itself to have to balance all of that out.
Yeah, I want to jump into a topic. We kind of mentioned it earlier in the podcast, but so you have a rare disease, and then you also are parents to, you have 2 children, right?
No, it sounds like 2, right? It's just her.
Oh, you just have 1? Oh, okay. So you have a child who also has a rare disease. How is that whole experience, being a parent of a rare disease child? And you also have
the siren does it well, right? I mean, it's woo! It's a wild ride. I mean,
yeah, I live in your city, guys, so this is normal.
There's no set, like I said, when it comes down to like I said earlier, having that gratitude. Like, sometimes I look at it, and I'm not saying like compare your lives to others and some. No, it's quite the opposite. It's like we're on these journeys, but sometimes it's nice, it's nice to see these other journeys that people are on that are very similar, because it can be sometimes so few in between to find to know of a family that has, chronic conditions, like that they have similar struggles, and the way that each person identifies with their conditions too, like those dynamics. It's no different than any other roommate situation with multiple people with conditions, like to find that, to find how to, kind of not deal with each other's things, but, just kind of work together and kind of, see how you can kind of just enjoy your time together with these conditions, because a lot of times it's not enjoying the time together. It's a lot of hard work, really.
Were you like prepared? Were you mentally prepared before you had you have a daughter, right?
Yeah.
Yeah. So were you
Yeah.
like mentally prepared before having your daughter that you're gonna have a rare disease, or how did that all like come into play?
I think it's a really good question, because I think that it's a question that like anyone who's like interested in becoming a parent or a foster parent or anything, it's something whenever you are in a guardianship type situation, like where you are responsible for a child that comes into the world. When I say responsible, you could even be the sibling of the person who's having the child, but where you're very involved in their care and their life, and you're going to be very involved in their aspects. It's something I think that it goes through their minds, like for a split second, like, you're just like, well, I hope this baby is born healthy and happy, kind of very generalized statements I think people have in society, where you're just like, you hope for the best. But what is that hoping for the best? I mean, yeah, nobody wants to know that anybody's suffering, but that's not necessarily always the case. Like, people aren't always, necessarily suffering with conditions. And I think that that's where it's very hard, like, that fine line, like we talked about earlier, where does this go into eugenics and things like that? Like, how do you know? Because I think that there's a lot of stigmas and things, especially like when they thought, well, maybe she's got Turner syndrome. No, she doesn't. She's got Milroy's disease as of right now, which is very rare.
Wait, so
And
she doesn't have the disease that you have?
oh, she's got her own condition.
Oh my God.
So yeah, it is like a separate condition, and we don't know more details about it, because genetics information is so limited still at this time for diseases
What?
that are more rare and not well known, because there's just not enough, orphan rare diseases type thing, where there's just not enough interest in studying the rare disease, because there's not enough people with the rare disease for it to be interesting or money making for a lot of companies to get involved pharmaceutically wise or whatever research. That's that whole bag of bones that I know that kind of is it's a whole nother situation where
No, it's unbelievable that you have your own set of rare diseases, and then you get birth, and then like normally it would be like you have a rare disease, and then like I don't know, I forget what you call it, but like there's like a shock.
no, she definitely, my partner Carmi, since we've been married and everything, like, it's his house, like we've realized that he most likely has EDS himself and stuff, and as well, and he or he's on the spectrum, some sort of hypermobility disorder. And Maya, my daughter, she's like, she's showing signs of, things. Do we know if it's just part of her rare genetic disease, or is it this as well? Does she have multiple things? Like, we don't know. There's a lot of stuff, again, like, that's not really well known. And a lot of these things, even if somebody has a genetic test and it can test negative for a certain condition, doesn't mean they don't have it. It just, the combination of whatever the condition is might be showing up in a way that's not picking up by the test or whatever. From what I understand, what the geneticist told me, specifically about her condition too. Like, some people, they have the condition and the genetics, it just doesn't show up in that particular gene, that it's somewhere else they haven't researched or found yet. Like I said, like, these diseases are just not, research well known enough. And that's why it's so important, though, because there's so many people that are affected, and then people that get born. But people with Turner syndrome, or like, let's say you're pregnant and they suspect you have Turner syndrome, the child in there, it would be a girl, because it's a X related condition.
Oh, really?
Yeah, so basically Turner syndrome just means that you're born your X chromosomes are you're born without one X. So but so then they thought, since she tested negative for that, they thought it was mosaic Turner syndrome until another geneticist looked at what her condition was, and they said it was Milroy's disease. So again, it's just these journeys. It can be such a long process for this stuff. And every parent, like, when you're pregnant or whatever, you want your scans to be normal, whatever. But people shouldn't be so quick to, the doctor might suggest terminating or something. They might say, oh, they're gonna have a hard life or whatever. Well,
But
they didn't suspect anything on ours. Ours scans came back normal. They didn't see any swelling conditions on in there. If there was swelling, they just didn't notice it, I guess.
Wait, did you monitor the baby as it was growing inside a room?
Yeah, just as normal. Like my pregnancy, the scans you get every so many weeks. You're supposed to go get a ultrasound to see how the baby's growing and see how things are, going for that, and genetic testing and things like that sometimes can happen depending on, family history and things. But again, access to this stuff and information and newborn screening. Like that's another thing. Like people don't even know it happens, like at the hospital. Like they just automatically
brand new.
Yeah, I mean, well, and that's the thing. It's kind of all over the place. I didn't even really know. I've been trying to find out more information about that, and each state kind of is running the program like its own country in a sense. So you could have your child in one state and not know it has a disorder. If they just were born in a different state, they would have known. It's crazy how that whole thing works. But that's why it's so important that there's more, talks, more education between specialists and, and the patients, because I've talked to a lot of like women and stuff that they don't know their options and stuff. And I know women that have babies that, they were told, lots of different things, and it's really sad to hear some of these stories, like they were told, but that's unfortunate that this vibe of eugenics still kind of exists, that you're told that your child will be a burden if you choose to keep them, type of
I'm in like
it's
I'm
sad.
like I'm in like a weird stance in terms, like I wouldn't want my disease to put on another child just because of how horrifying it is. And the last thing I want is my child to be suffering because of me, and just because I want a child. And that it's just not fair for the child to have that. So I'm like always in like an argument in my head. It's like, should rare disease people be able to procreate because they have, they have a high chance of passing their rare diseases onto the child.
But that's what's so important. That's why I'm so glad you brought that up, because that's like the common misconception that's been going around for decades, is exactly what you just shared. And now it's not so true anymore. Now we know so much more in the past just decade alone, 10 years alone, about genetics, that there's so much more that we know and what we can find out. For instance, I did the extended panel genetic screening for newborn because of my risk factors. I knew with my health issues, I was worried about that. But it just goes to show that, like, nothing's a perfect thing. And I didn't do all the tests that I could have done. I could, but could I do more? I don't know. Would have picked up her particular disease? No. But does it matter? Because no, at the end of the day, disabilities, abilities, abled, disabled, it's all the same. Like, we're all people. And do we want to pass on something that's painful or harmful? Of course not. Nobody wants to do any harm, but if there is a choice and we know more information, if there's accessible information and finding out that there's not only just opportunities for procedures and treatments, but there's actual ways for people to have children now that was not possible 10 years ago. That's the thing. I think that, it hasn't reached the death, so to speak, of everybody yet. And a lot of people, don't know necessarily the information. Like, for instance, they can almost guarantee, because you're a male. So like, it's a lot of times it's easier in that sense. Because you're not the one that's gonna grow the baby. As far as I know, like, you're not gonna be female tomorrow, or I don't want to use the word female, but I'm just saying as like a joke, right? Like, you're not.
You never know.
You're pretty decided on not carrying a child right now.
You never know. I don't know.
You never know.
I'm having second thoughts right now.
All right, Joey. So you want we have an announcement? Yeah, no, I'm just all joking around. This is all jokes. Joey and I we're just joking.
I don't know. I never joke.
No, I'm not. But I'm not. What I'm saying is, I'm personally joking around. For any listeners here, I am not. I'm not trying to. I'm just being lighthearted about this. But my whole point being is that there's options. It doesn't matter if you're what gender you are. Is my point is that some things are easier depending on what gender you are to go about certain procedures and certain things, certain options depending on your age. And all sorts of different factors. And when I say age, I just mean because age does play a factor into the age plays into a factor of what if somebody if they are able to have a child, like their eggs are viable, I guess is the correct term. The eggs are viable, meaning their eggs are, healthy and mature or whatever it is, because a
Emily's child is 4 years old, but like, so much has happened in 4 years in terms of the medical community. Like, just recently, like, more tests are being done for newborns, and like Emily mentioned, that the earlier you get diagnosed with something, the easier the road is, so you can get more help with that condition, or you could even prevent future things from happening just because you were diagnosed so early. That's a big problem with the rare disease community. That I think it's it's a high percentage to be misdiagnosed, and misdiagnosed can lead to problems. And let's say you get a procedure done and you didn't need it done, it could do more harm to that person, and it creates more problems in the future, and it keeps growing to a snowball and keeps getting larger and larger.
For sure. You're absolutely right. And a lot of these things, a lot of doctors or, specialists are coming now, figuring out a lot of these things are, metabolic disorders and things that are underlying that are causing these gastrointestinal distresses and other things where there doesn't seem to they can't find like a reason. There's a genetic basis is what I'm saying. There's a genetic defect, and some of these are, inborn errors of metabolism and other things like that have to do with, all sorts of stuff related to newborn testing and screening, that if these things are there, like you said, this can really help. Specifically that, like a person like myself, I probably would have gotten a lot better care and health management, which is what I hope for Maya. Like everything, that she's been involved with is, programs that have helped her, quote, catch up. I wouldn't say catch up, not that there was like a standard of where she should be, but in the sense that giving her if there is an opportunity for a child to be kind of in a more kind of an average range, like let's say that the person is struggling with a certain thing and they have the opportunity to, if they want, it's hard to say. Let's just say if the opportunity is there to help them be the best that they can be, then you should take it. Because if you're not giving them the opportunity to be the best they can be, that means that they are surviving and not thriving. And I think that there is a very hard line and but very, very blurred line as well, where people have their own viewpoints about that. A lot of that has to do with the industries of that people work in, as far as different care industries and social services. There's different schools of thought about that. But again, this is just goes into just plain old ableism and deciding what you think is best for another person without truly considering what is actually best for them in their own personal interest and what they feel.
Yeah. Well, you like when you were talking about caring for the child, it like occurred to me just now that once you like turn 18, everything just goes like south in terms of help and support. It's like you're just on your like if you have especially a rare disease, you're just kind of on your own. Like
Yeah, I mean, unfortunately, if you're once you age out of pediatrics, it's a very tough transitioning time. It's very hard, and I think that that's where young adults, they, especially in the chronic condition and rare disease space, get left behind because there's all this attention to younger folk. They're like, oh, they're just so young. They're a teenager, or they're a child, and they're just, there's this attention towards that group, and then there's attention towards the older folk, people who are older that, like I said, we both talked about earlier, how like it's just normalized to just be so caring and nice towards elderly people in decline, or older people, or just, if somebody, or even in their 40s or 50s, if they have like a heart surgery or something, there's just this sort of niceness about it. But when you're stuck in this kind of middle phase of this young adult space, that's where it's like you're kind of like lost in between it all. And I think that's what's been so great about our Odyssey, this organization I've been involved with the past year. I mean, I couldn't even even begin to say how much that has really helped fit in these communities, as having that space that kind of connects people with one another, that that are young adults with these complex health odysseys. It's something that you experienced, Joey, personally. I know listeners that aren't familiar with our Odyssey, like you found our Odyssey, we made the connection through our Odyssey, and that's what it's all about, is bringing community together and sharing our stories and sharing
I did want to tell the audience that Emily is a volunteer, and she volunteered for would you say they're a company? They're a nonprofit that gathers rare disease people. So if you have a rare disease of some kind, or even caregivers, right? Or just rare diseases.
Yeah, so it's just for young adults with rare chronic conditions. So you don't have to have a rare disease, but if you have a chronic condition, a chronic illness, a chronic disorder, of that, however you want to call it, something that, is chronic, that doesn't, go away, that, our Odyssey is a space for you to be, that we have different meetups where we can just hang out and chat. And some of them are, we have some kind of little topics that we'll discuss. But other than that, it's kind of just a nice space to be, because there's a lot, there's a lot of professional programs out there that connect people, but it's on this level where you have to sign up and you have to wait on a list. I'm sure you've probably heard of some of these kind of types of organizations and things. And that's what makes our Odyssey different, as a nonprofit. It's
our Odyssey is a very casual group of people. There's 7,000 rare diseases out there, and like maybe there are people out there that never met someone with their disease, and so here's your chance to meet someone with your disease, or even if they don't have your disease. Yes, everyone is going through their own different challenges and stuff, but we're like different, but we're like at the same. We're like different but the same. It's like very weird to explain. Okay, I mean, like we all have different problems. We have also deal with the same problems, in terms of like, oh, we can't reach these things, or, like one day we can walk and the next day we can't. Or, somebody might just be looking good one day and then the next day they're just like in bed all day. But like this is a community just to, you don't even have to say anything. You just come and join and just be around people, because I know it's isolating to have a rare disease, and if you can't go out and such, and like to just be around people. So here's your chance to be around people. You don't have to explain yourself as much because everyone understands. Like if you can get, like, one guy couldn't get out of bed because, but like if he would talk to a normal person, like, why are you so in bed? Like, let's say a work meeting, this, our odyssey is like, we don't really care. We kind of understand, like, some people just have to be in bed all day, every day, or they're just not feeling it well. When it's totally casual, like no one's like dressed nicely at all or anything. They're just lounging somewhere in their pajamas.
Yeah, I was about to
One like
say,
had a
like, everybody.
blanket around them, like it's so casual, and it's like from my experience, like the first time I ever joined, I was pretty like, well, it was like welcoming. I mean, it's always intimidating to be in, but it's like welcoming. It was like kind of like going to a nice family, and like yes, you have to go a couple of times to get to know you, but like it was like they're so inviting and welcoming, and like if you have something to say, you can say it, and then no one judges you and tries to understand and try to help you out.
Yeah, definitely. I mean, it's just, a place in that sense to just be connected and to share resources in that sense, not pushing resources. I just meant like in a very nonchalant, not, very casual kind of way, just of,
Yeah, you don't go for
being
like
able to connect.
medical. Yeah, you don't go for like medical advice or like medical opinion. It's just one person have their experiences and what helps them
Hmm.
to help you.
Yeah, and sometimes that happens though, in the sense that like it's just life. Like somebody's like, yeah, I just got diagnosed with this. Like I have nowhere to turn. Like I just want to vent right now. And like, if you have any tips, like, and that's sometimes what we do. You can give someone some tips that maybe work for you, and then you can talk about it with your doctor. And that's something that we always say. Like we're not
Yeah,
no professional medical advice happening. I mean, some people are professional medical people, like in their in their work life or past work life or whatever. It's just but it's nice to share information that you can like end up, being like, yeah, oh, I had no idea about this. Like for instance, like a neck brace. I was really struggling for one, and somebody had told me about one, and I don't use it that often because for several reasons. But it was like I have it, and when I like really need it, I can use it, and it's something I knew would work for me, because it's like I don't want to just buy something random and then waste, I can't afford to waste my money or not be able to take it back, or all these different little nuanced situations with that crap. So it was nice. It's nice to be able to share and in that way. And yeah, like you said, a lot of people have different rare diseases, but we can just come together in that sense and just kind of um,
yeah, we're here.
hang
Our odyssey are just here to help each other and support each other. Like we all know we're going through shitty situations, but we're just doing our best to help each other and like strive to be something in this
Yeah,
world.
exactly. And that's what's different about it too, is because a lot of these organizations are out there trying to like tell you, oh, you need to to fix yourself, or like have this like wellness guru aspect of it. Or it'll be the opposite, where it's like, oh, this like commiserating, like moping fest. And it's like our odyssey is neither one of those things. It's like in the kind of in the middle, like how things kind of should be. I know I kind of like was thinking about that recently, um and mentioned it to someone in a similar way. And because it is true. I mean, like once you go, you see it's not one of those two things. It's more of like this happy medium of like, yeah, you can commiserate in certain moments, and yeah, you can talk about wellness guru stuff in certain moments, but there's no vibe of that there whatsoever to begin with. There's none of that there. It's just if somebody happens to be on a subject that's similar to those things, it can happen, but there's no vibe of the whole organization, and that's not there at all. The vibe of that's there is just being there to connect and share, and just literally being there, because that's what it is. Some people don't want to go on camera or even talk. They'll just, and that's it. And that's the whole point.
Like Emily.
Yeah, like me right now. I mean, everyone can see it's just my picture, but this is what works for me. And right now, I physically I could not hold it, and even if I was putting it on the table, I knew I wouldn't be able. I would have to hold my head in my hand, because I can't turn my head to the left very well. And it's just, it just works better. I mean,
everyone had their own set of problems, and I try to be accommodating. And if she didn't want a video chat, I'm not gonna force her to do it. It's whatever she's comfortable with it. So like that's really it. Like, you can't force anyone. She's comfortable in her area, and that's the best I can hope for. Is that she's comfortable to give a podcast and have a chat.
Exactly. And just, also my daughter kept popping in, everybody heard here and there, but that's what's fun about, about my life as far as things go. It's always an adventure. Like, I've always, throughout my life, even like all the little struggles I had, because that's the thing. It's like my disabilities have always been there from birth. I mean, I like to use first person language, I'm disabled, but it's, talking about it in like the past sense, like those things were more invisible at certain moments. I spent entire time in society trying to like hide my disabilities, hide the fact that I'm disabled, hide because of how things were and how sometimes I'm continuing to be treated by a lot of people that have their own health issues themselves, and they want me to hide my issues and not have them be so out there. And that's okay, each to their own. And I understand we all have our own struggles. And sometimes people just don't have room for another person's struggles when they're struggling so much themselves. And they might not see it as struggling. They might not see themselves as struggling at all, but they just don't want to deal with whatever else you got going on, which is, a lot of what I have going on. But that's okay. Continue to surround yourself with people who do get it. Like, like we were just talking about with our Odyssey, just keep surrounding yourself with different things like that. Get involved, with your community and stuff, and the ways that you can kind of come together and share and learn in these ways.
Well, I'm happy that you're open to sharing your story and sharing, your life with me and the world. Like, it's not common for someone to be so open and such.
Yeah, I just some of it is just I felt like I have no choice. I mean, when you say like, oh, what's it like, that it's a wild ride with having multiple people with rare diseases, because it is. It's can be challenging to try to figure all this out. It can be, I don't know, some of it is like I figured out I couldn't get the supports I need. I kind of just I've been around a lot of privilege and a lot of wealth, and I've also seen a lot of the opposite too. I've been around, I know my place, I know my privilege, and that's why I work so hard to make sure that I can help people who are disadvantaged, that don't have the same opportunities or same access to opportunities. And then when I found out I personally couldn't even access some of these things, or I didn't realize, what it was going to be like. People make the joke, like they think that, like you said, about wheelchairs being so expensive. Like they think, oh, like you go on disability, you get this money and you get a free wheelchair or something. It doesn't work like that at all. But there's some sort of weird stigma that even myself, where I was like, okay, well, my invisible disabilities are no longer invisible. I can't keep them under control. I need help, and I'm going to need assistance. And I had assistance in various forms throughout my life for certain other things. So I wasn't that uncomfortable with asking. But then when I found out I couldn't access certain things, then I found out that certain therapies, like Maya's lymphedema therapies, not covered by insurances and things like that, and finding out I needed to get involved, that I can't get any more antibiotics. I had a 1 month's dose of antibiotics for the Lyme disease, just about a year after I got bit, and I didn't get better after that. And nobody can help me now. Like it's ridiculous. So I'm sharing my story because a lot of it just, I don't have a choice. Like it's sad that I can't get more assistance, that people are, that it seems like, it's not that they don't care. Like the infectious disease doctor said, I really do want you to get help. I do care about you as a person, that I do see, how you're very sick, but I can't help you. And for doctors to say, I can't help you, and you are sick, but I can't help you, and I don't know who can help you, but there's options out there, but I don't know how you can access them. Like, and finding out and experiencing this. I mean, I didn't say it here, but in the other podcast I was in, I talked about my experience with Lyme disease in my past, working for a woman who didn't know she had it and then find out she had it, and the devastating effects of being infected for years without knowing you have it. And it's like, I know I have it, and I'm watching my life get worse because I'm not getting treatment, even though I should be getting treatment, because I'm a smaller percentage of people that have a timeline, that I have everything documented. That's still not good enough. Like, and then where does all this, come into play? Like how I can't access treatment because I have to pay for a private doctor, and it's going to be several thousands of dollars a month. Well, I thought that was just because my boss and other people were not accessing, that they weren't exhausting every possible resource. So here I became that experiment, a living experiment of exhausting all resources. I've done everything I can the past year and a half, and now here I'm at right now, where thankfully, I mean, specialists see, I need supportive care, the supportive care clinic for palliative care, because if I'm not going to get treatment, things aren't looking so bright for me. As we both talked about earlier, our timelines for things are, different than other people's possibly. And especially, if I don't get treatment, I mean, it is what it is. And unfortunately, my particular situation, you probably don't know, and I don't know how much of the other podcasts you listen, but these are co-aggressive diseases. So to treat Lyme disease, it can be really dangerous because it can make the EDS worse, and vice versa. So there's basically, I'm just kind of stuck, right? There's not really much I can do. Yeah. So, and if somebody's not willing to like take my case and like get the insurance to try to pay for some treatments or something, which, this doctor said I'm worse, that I'll leave you worse off than you coming in. If I try to give you anything right now, you're going to get sick. Like, it's like, that's not acceptable. It's not, these situations are not, they shouldn't be acceptable in America, especially for, I am putting my privilege out there in that sense. Like I thought I was using it for that situation. I'm like, okay, here I am. I have over a dozen certifications, and I was like, I can navigate this stuff. Like I can do this. I can find a way. And then finding out there's no way, and that that I'm gonna have to tap into even more resources to try to get, and it'll take traveling and taking someone to actually consider me like a charity situation, possibly, to get some treatment. But that might not necessarily happen or even work. Like I said, a lot of people, it's a tricky situation, kind of screwed if you have some of these multiple infections and diseases. So it's just nice that when you do get the support, like I'm getting certain areas of support, my team built up. And it's nice, I personally, and I think a lot of people would agree, that it's nice to hear a doctor say, I'm not sure how to treat you. I'm not sure how to go about treatment, but I'm willing to learn and try and support you. And those similar words, I had a doctor say to me, and I had multiple doctors say they don't know how to help me, but they're willing to try, and that's all that it takes. It just, somebody to help treat you and support you, and making sure your condition is as stabilized as you have the opportunity to have. That we should have the opportunity to have, to be the best we can be, even if there's no cures or certain treatments. But if they're there and there's a connection to have the opportunity, then people should have the right to access these care treatments and care needs. And that's where, like, sharing my story really comes in, because it's kind of came in disbelief that I'd have to get involved with the Center for Lyme Action and get involved with the Lymphedema Treatment Act, because advocating, I realized I can do something, in the sense that if I'm not able to work and do all these other things, if I can at least, like, just make it well enough to make one phone call to a senator or something, or have one meeting with a senator or something, and advocate and share my story and say, I need help and I'm not getting help, and other people are just like me in my situation, and then finding out it's has nothing to do with, like, race or something like that. You know what I'm saying? Because I'm quote white passing. Like, I'm not quote white. Like, I feel weird filling out that on the form, because I have so many different cultural backgrounds for myself. And it's just, knowing that, because my husband, he'll have people turn the other way on the street. Like, he'll be walking and somebody will turn and walk the other way because of the color of his skin. When my skin gets I'm very pale because of my health now, but my skin's pretty naturally mostly tan. And I didn't understand how people were treating. They kept saying, "Oh, is that your daughter? Is that your daughter?" Because she looks different. Her skin is really, really dark. And people keep thinking that I'm not her mother or something. And I was so used to that, because I nannied for so many years, that I was just so conditioned to be like saying, like, "Oh yeah, that's not my kid. Like, I'm babysitting, or I'm nannying, or oh yeah, like, or I wouldn't care if they thought it was my kid at the end of the day. Like, I'm caring for this child and I love them. I'm getting paid and I love them. Like, not the money, I was doing the job because I loved it. If I wanted the money, I'd do another job that made more money. You know what I'm saying? Like,
Yeah.
And so having those experiences really help shape, like, how I see things now for what it is, with how, how racism and ableism, all these things intersect. And then when it's a paper trail and there's no color, there's no race involved or anything, when you're just finding access of care and you're using your education and knowledge and connections to access care, then you find out there's a brick wall for everybody. That's when there's a problem. And that's what happened with the lymphedema and the Lyme disease. That's why I'm advocating for those more than anything else. That's why I'm only advocating for those, because those are brick wall situations that we have fundamental red tape, that this is accessibility issues for no matter who you are, which I'm not saying that it's right for for treatments to be only accessible to certain types of people. But I'm saying that if it's accessible to nobody, then why is that happening, right? Like, why are policies that are so outdated?
I just want to thank Emily Hall for this fabulous interview, and thank you to my listeners for listening. My name is Joey Sooch. This is to Mics One JoeySooch, and I'll catch you later. Bye bye.